Hey, I'm Dr. Shane.
And I'm Dr. Ben. Thank you for choosing Heritage Oak Dental for your oral health care needs. You're getting this video today because you're leaving the office after having a tooth extracted. And we wanted to give you a couple pointers to take home with you in case you forget.
So first of all, you're going to be very numb. That's a good thing. We're going to be pain-free. But we want to make sure we don't accidentally bite our lip, our tongue, or our cheek. When the numbness starts to wear off, we want to be ahead of that. So I want you to take ibuprofen typically, of course, if that's something that you can take at home. It's over the counter and it typically comes in 200 milligram tablets. And we want you to take 3 of those every 6 hours. And I want you to do that for the first 2 days because we want to stay ahead of the pain and stay ahead of the inflammation. Speaking of inflammation, let's make sure we're icing the soft tissues and the areas around the extraction site and the injection site. Swelling equals pain for a long period of time if we don't avoid that swelling.
Also, let's talk about what you can and cannot eat. You have a list. We gave it to you in your post-op instructions, but just a couple of pointers. Stay away from nuts. Stay away from things that are hot or spicy. That can really aggravate the site. Anything that's hard could get stuck into the extraction site and delay the healing process there. So just really take it easy. A couple things I would recommend eating. Anything with good protein in it, like eggs and sausage, soft textures like that. Even protein shakes are wonderful. If you get good protein in it, good vitamins in it, you'll heal faster.
And we're going to talk about now the hygiene. How do we care for the area? We're going to brush our teeth and keep a clean mouth. We're going to be flossing normally everywhere. But in the extraction site, you might want to turn off that electric toothbrush or brush very gently or softly to avoid the area, just in terms of how tender it can be immediately afterwards. But keeping a clean mouth is part of healing more rapidly. After we've cleaned the area, we can utilize saltwater rinses to help cleanse the area or any foreign objects or food particles that might be getting into the area. But it is important that we leave that clot or that scab there for that 24-48 hour period so that it can help make sure it protects the site.
That's amazing. The body can heal from so much, and it's an incredible process. Just let it do its thing. Lastly, thank you for choosing Heritage Oak Dental. If you have any more questions, check the post-op instructions that we gave you on the way out. If that's not enough for you, give the office a call and our girls would love to take care of you. Okay? Thank you. Have a good day.